This is a review of the human heart model. So this view shows the outside of the heart, but when this half is removed, you can see all of the internal structures. First of all, you need to be able to identify which side is the right and which side is the left. This is the right side of the heart, and this is the left side of the heart. The superior chambers are called atria, and the inferior chambers are called ventricles. So this is the right atrium, this is the right ventricle, this is the left atrium, and left ventricle in here. There are atrioventricular or cuspid valves that separate these chambers. So here is the right atrioventricular valve. It's also called the tricuspid valve. And then on the left side is the left atrioventricular valve, also called the bicuspid valve, and also known as the mitral valve. Attached to the cuspid valves are string-like structures, which are called chordae tendineae. These prevent the cuspid valves from opening in the wrong direction and from turning inside out. So chordae tendineae, and on this side as well. And on the other side, the chordae tendineae are attached to papillary muscles. Here, here, and then here as well. This structure, it's mostly muscle that separates the two ventricles, is called the interventricular septum. And up here is the interatrial septum, which separates the two atria. There are also several blood vessels that enter and exit the heart directly. So exiting the left ventricle is the aorta, and at its entrance is the aortic semilunar valve. This section is called the ascending aorta, and this curved section is called the arch of aorta, or the aortic arch. And there are several branches coming off of the aortic arch. This branch goes to the right side of the body, and it's called the brachiocephalic artery. This branch goes to the left side of the body, and it actually goes up the neck. It's called the left common carotid artery. And this branch goes also to the left side of the body. This goes towards the arm, and it's called the left subclavian artery. This large blood vessel that carries blood into the right atrium is called the superior vena cava, and coming up from below and behind the heart is the inferior vena cava. Also, right here, this blood vessel is exiting the right ventricle. This is the pulmonary trunk. So if I put the other half of the heart on, you can see some of the rest of that right here. This is the pulmonary trunk. And if we look into this half of the heart, you can see the pulmonary semilunar valve. Also, on the outside of the heart, there are many coronary arteries and coronary veins. So these small blue veins are coronary veins, and the small red arteries are coronary arteries. One final thing, the majority of the heart wall is composed of the myocardium. So the thick muscular layer that you see all around the heart is the myocardium, and it's especially thick on the left side, in the left ventricle.